You have a health insurance plan. You have a deductible. You have been paying for it all year. And then on January 1st, something happens that feels like a cruel joke. Your deductible resets to zero. All those thousands of dollars you paid toward your out-of-pocket maximum, gone. You start over. It feels arbitrary. It feels unfair. And here is the question that almost no one asks. Why does your deductible reset every year? Is it just a trick to make you pay more? Or is there a logic to it that you can use to your advantage? The answer is both. And once you understand the calendar, you can time your medical care to save thousands of dollars. By the end of this video, you will understand exactly why deductibles reset annually, how insurance companies use the calendar to shift cost onto you, and most importantly, how you can use the same calendar to pay less. I will give you a specific timeline for scheduling your medical care, from physicals to surgeries to prescriptions. You will learn the 3 critical dates on your insurance calendar and the 1 month when you should never have a major procedure. This is not about cheating the system. It is about understanding the system so it does not cheat you. Let me start with the simple answer to why deductibles reset every year. Health insurance policies are annual contracts. Your insurance company agrees to cover you for a 12-month period. At the end of that period, they recalculate your risk, adjust your premium, and start a new contract. The deductible and out-of-pocket maximum are part of that annual risk calculation. If deductibles did not reset, people would have an incentive to delay care until after they had met their deductible in a previous year, then get all their expensive procedures done for free in the next year. The reset creates a clean slate and encourages you to use your benefits within the plan year. That is the official explanation. But here is the unofficial truth. The annual reset is also a profit center for insurance companies. Every year, millions of people pay thousands of dollars toward their deductible and never meet it. That money is pure profit for the insurer. They keep it, and you start over. That is why timing your care matters so much. Now here is the pattern interrupt that most people miss. Your plan year does not always align with the calendar year. Many employer-sponsored plans run on a calendar year, January 1st to December 31st. But some plans have a different plan year, starting in July or October. You need to know your specific plan year. It is on your insurance card or your summary of benefits. If your plan year starts in July, your deductible resets in July, not January. That gives you different windows for scheduling care. Do not assume the calendar year. Check your documents. Now let me break down the 3 critical dates you need to know. The first date is the start of your plan year. On this day, your deductible resets to zero. This is the worst time to schedule expensive care because you will pay the full cost until you meet your new deductible. The second date is your deductible amount. That is the number you must pay out of pocket before your insurance starts sharing costs. The third date is your out-of-pocket maximum. That is the most you will pay in a year for covered services. Once you hit this number, your insurance pays 100% of covered costs. Understanding these 3 numbers is the key to timing your care. Here is the strategy. If you know you are going to have an expensive medical year, you want to hit your out-of-pocket maximum as early as possible. Then, everything else for the rest of the year is free. That means you should schedule all your expensive procedures, surgeries, and specialist visits in the first few months of your plan year. Pay your deductible early. Then enjoy free care for the remaining months. For example, if you have a $3,000 deductible and a $6,000 out-of-pocket maximum, and you know you need knee surgery that costs $20,000, schedule that surgery in February. You will pay the $6,000 max. and your insurance pays the remaining $14,000. Then you can get your physical therapy, your follow-up visits, and any other care for free for the rest of the year. If you schedule the surgery in November, you will pay the $6,000, but then have only 1 month to use the free care. That is a waste. The opposite is true if you are generally healthy. If you rarely go to the doctor, you want to schedule your preventive care and routine visits early in the year. That way, if something unexpected happens later, you have already started paying toward your deductible. Do not wait until October to get your annual physical. If you get sick in November, you will pay the full cost of that illness because you have not met your deductible. Get your physical in February. Get your blood work in March. Get your mammogram or colonoscopy in April. Spread your preventive care across the first half of the year. That way, if you have an accident or a sudden illness later, you have already paid a chunk of your deductible. Now let me talk about the 1 month when you should never have a major medical procedure. December, the last month of the calendar year for most plans. Why? Because if you have a procedure in December and you do not meet your deductible, you have wasted an entire year's worth of payments. And if you have complications or need follow-up care in January, that care will be subject to a brand new deductible. You will pay twice. A patient in Ohio had surgery in mid-December. She paid $3,000 toward her deductible. She did not meet it because the surgery cost was partially covered. Then she needed a follow-up procedure in January. Her deductible reset to zero. She had to pay another $3,000. If she had waited 3 weeks to schedule the surgery in January, she would have paid the same $3,000, but it would have counted toward her new plan year, and she would have had the entire year to use the rest of her benefits. Instead, she split her payments across 2 plan years and paid twice. December is the worst month for expensive care. The best month for expensive care is January. Schedule your surgery, your MRI, your expensive medications as early in the plan year as possible. Pay your deductible once, then get everything else for free. That is the secret that wealthy people and savvy insurance shoppers use every year. Now let me talk about prescription drugs. This is where timing can save you even more. Many plans have a separate pharmacy deductible, but even if they do not, the same principle applies. If you take expensive maintenance medications, try to fill your first prescription of the plan year as early as possible. That payment counts toward your deductible. If you have a $300 monthly medication and a $1,000 deductible, your first 3 months of prescriptions will cost you full price. Then your 4th month will be cheaper. If you delay filling your first prescription until March, you push your deductible payments later into the year. That means if you have an unexpected medical event, you may not have met your deductible yet. Fill your medications early. What about health savings accounts? If you have an HSA, you can use it to pay for qualified medical expenses, including your deductible, tax-free. But the timing rules for HSAs are different. You can only contribute to an HSA if you have a high deductible health plan. And you can only use HSA funds for expenses incurred after the account was established. So if you open an HSA in January, you cannot use it to reimburse yourself for a December surgery. Plan your contributions carefully. Now here is the advanced strategy that most people do not know. If you have the flexibility to choose your plan year, you can shift your plan year to align with your expected medical needs. Some employers offer multiple plan year options. If you know you will have a baby in the summer, choose a plan year that starts in the spring. That way, the delivery and all the pediatric visits will fall in the same plan year, and you will hit your out-of-pocket maximum once instead of splitting it across 2 years. If you have a chronic condition that requires regular care, choose a plan year that aligns with your condition cycle. Talk to your HR department. Not everyone knows this is possible, but for some employers it is. Let me give you a real-world example of perfect timing. A couple in California knew they were planning to have a baby August. They also knew the wife needed a separate surgery earlier in the year. They chose a plan with a January 1st start date. They scheduled the wife's surgery for February. They met their deductible and out-of-pocket maximum by March. Then the baby was born in August. The delivery, the hospital stay, the newborn care, all of it cost them nothing because they had already hit their out-of-pocket maximum. They saved over $15,000 compared to if they had scheduled the surgery after the baby was born and paid 2 separate deductibles. Timing is everything. Now let me talk about the differences in the UK and Canada. In the UK, the concept of a deductible reset does not apply to the NHS. The NHS is funded by general taxation, and there is no annual deductible or out-of-pocket maximum for core services. However, if you have private health insurance in the UK, the same timing principles apply. Private plans have annual limits and deductibles, known as excesses. The plan year resets, and you can time your care to hit your excess early. Check your policy documents. In Canada, provincial health plans do not have deductibles for medically necessary hospital and physician services. You pay nothing for those services regardless of the time of year. However, private supplemental plans for prescription drugs, dental, vision, and physiotherapy do have annual deductibles and plan years. If you have a private plan through your employer, the same rules apply. Schedule your expensive dental work, your new glasses, and your physiotherapy sessions early in the plan year to hit your deductible and get the rest of the year's benefits for